Hey, just a little FYI, Scissors and Scrubs is stepping out of our little comfort zone. Yeah, we're gonna hang out with Keith Tassinari on Thursday, 12/18 at 6:00 on Wave Radio Boston, wrbrocks.com. It is a radio show, Rock and Reels. He does music, he does trivia, he does movies and games. It should be interesting.
It will be different.
Yeah, we were going to try to do medical movies. I don't know if he's doing that or we're doing Boston movies, but you're going to see Laura and I large and in charge right there on Rock and Reels. It'll be interesting.
I'm having a nervous breakdown.
Well, you better be there. That's all I'm going to say.
I might be late, but I will be there.
You better be there.
I will be bright red in sweating. But
yes, but you will be there. Yeah. So we hope to see you all there. It should be a fun night. You get to see our gorgeous faces on
that's another thing.
Hopefully I'll have contacts by then. I'm getting fitted for contacts in the morning, so that should be interesting. Because I'm old and I can't see shit anymore. Yeah. All right, wish us luck. We'll hopefully see you Thursday.
Hey, tune in.
All right, welcome back to Scissors and Scrubs. We are in the holiday season.
Yeah.
I'm Nicole.
I'm Laura.
And we're doing a little different theme this week. Yep. We're going to go with Hanukkah. But we're not doing like a really joyous Hanukkah. We're doing all the diseases that are prone to people of Jewish descent.
Yes.
It is the Hanukkah season. What night is the first night of Hanukkah? It's coming up, isn't it?
Next Sunday?
This week? Next week? Give me 1 second. I'm going to look at my phone because it should be on here. Hanukkah starts on the 15th, the day this comes out.
Perfect.
So,
look at us.
Let's start the episode by saying Happy Hanukkah to everybody.
Hanukkah.
8 crazy nights. I have my information from Sinai and Synapses and also from the Mayo Clinic. And I've heard of this disease a lot. Mm-hmm. It doesn't strike only Jewish people, but it also is like Amish, like people who are very close-knit communities kind of thing. Okay. So we're going to discuss Tay-Sachs disease.
I've heard of this a million times, and
I've heard of it as a kid, and I know it was devastating. It is a devastating.
Yes.
There is no cure for it.
Yes.
There was no treatment for it. It is a disease that is found most frequently in the Ashkenazi Jewish population. Hopefully I pronounced that right. More than any other cultural population. Ashkenazi Jews are the most readily recognized Jewish ethnicity in North America. They have all the great food. They originated in medieval Germany. Wow. The Ashkenazi refers to Jews of Germany, and it is current-day meaning incorporates Jews from Central and Eastern Europe. Polish Jews, Lithuanian Jews, all the Slavic Jews are grouped under Ashkenazi. Okay. Along with their great culture and customs, they are also prone to genetic diseases known as Tay-Sachs. This is just like... It's the fucking worst disease in the world, okay?
Mine not pleasant either.
I thought Huntington's was bad. Tay-Sachs may top it. It's an awful disease that doesn't appear till almost 6 months old. So you have this beautiful baby, and you're like, my baby's fine. 6 months old, that all comes to a screeching halt. Mm-hmm. And then it ends with devastation. It is a disease of the nervous system. And I didn't get really deep into enzymes and names and stuff. I'm giving you kind of a... overview because I can't pronounce that shit, Laura.
Oh, wait, just wait till mine.
So it is passed genetically from parent to child. It is the absence of an enzyme that breaks down fatty substances. I'll give you the name of the enzyme. Not that it's going to matter. Gangliosides. Gangliosides. Yeah, okay. That works for me. Yeah. They build up to toxic levels in the brain and spinal cord, and they affect the function of the nerve cells. Most severe cases show up between 3 and 6 months. Oof. Juvenile onset, they can live very rarely into their teens. Usually by 10, they're done. Oh. And there is a rare onset that shows up in adulthood. So if you're born with Tay-Sachs, you appear normal till about 6 months, and then all of a sudden you lose the ability to smile, to crawl, to sit up, to see, and to move.
Oh, my gosh.
They become bedridden and require constant care. Oh. That will be followed by seizures and a coma, and death between 2 to 3 years of age.
Oh, my God.
Is it tragic enough? Your baby stops smiling, and then they die at 2 to 3.
Right.
Happy Hanukkah. Juvenile onset, the death is by 10. And it appears that when you get into adulthood, that can appear anywhere from 20 to 40 years of age, and it can involve motor and mental involvement. Signs of infant Tay-Sachs are exaggerated startle. You know, like you hit a baby and they shake. This will be really like over the top. Yeah. Cherry red spots in the eyes. These are actually on the back of the eyes.
And
they showed a picture of it. If you look at the retina, there's a big bright red dot in it. Loss of motor skills, loss of turning over, loss of crawling and sitting up, muscle weakness leading to paralysis, movement problems, seizures, vision loss and blindness, hearing loss and deafness, problems swallowing. They will get an enormous head, macrocephaly, and loss of mental functions. Functions, not functions.
Good job.
The juvenile form, you have behavioral problems. They gradually will have a loss of skills and movement control. They will have frequent respiratory infections, slow loss of vision and speech, decline in mental function. So I got to flip my page. So it sounds like juvenile onset. It's basically the same symptoms, just at a slower rate. Loss of responsiveness, and then they start to also have seizures. Late onset in adult, it's rare and it's also less severe if you get to that age. The severity of symptoms vary greatly and they don't always lead to death. You can have muscle weakness, clumsiness and loss of coordination, tremors and muscle spasms, loss of the ability to walk. You have problems speaking and swallowing, psychiatric disorders. Sometimes you'll have loss of mental functions. Risk factors for Tay-Sachs. You are an Ashkenazi Jew. Certain French Canadians in Quebec, which I thought was very strange. The Cajun community in LA, and not LA,
Louisiana.
In Louisiana. There's a huge Cajun community.
Yes.
In LA. I don't know if you're aware of it, right down in the barrios there. Yeah, huge Cajun community. All right, the Old Order Amish. I don't know how they're different from the New Order Amish, but the Old Order Amish. And currently, there is absolutely no cure for it, and there is absolutely no treatment for Tay-Sachs disease. So that is kicking off our Hanukkah and how lovely Tay-Sachs is, these poor people.
Terrible. All right. Well, I did spinal muscular atrophy, or SMA, which is what I'm going to say from now on. And I got this information from lifetakesmuscle.com. SMA,
Life takes muscle.
Yeah. SMA is a genetic neuromuscular disorder characterized by progressive loss of motor neurons, which leads to muscle weakness and atrophy. It is mostly caused by a mutation of the SMN1 gene. That gene is essential for the survival of motor neurons in the spinal cord. The mutation causes a loss of neurons, which makes the muscles unable to receive signals from the nervous system, which then makes the muscles atrophy and become weak. SMA primarily affects skeletal muscles. Obviously, we have different smooth muscles, whatever. But it mostly affects the skeletal muscles. The same Jewish population have a higher carrier rate of SMA. 1 in 41 people carry this gene
high.
in the Ashkenazi Jewish population, which makes genetic screening crucial for that population to help with the prevention of the disease. There are 5 types of SMA. Type 0 is congenital SMA, which is evident before birth. It leads to severe weakness and respiratory failure shortly after birth. Type 1 is Werdnig-Hottmann disease. This is the most common form and it usually is diagnosed before 6 months of age and results in significant motor impairment in these patients.
Poor people.
Type 2, the symptoms appear between 6 and 18 months. People can sit, but not, these patients can sit but not walk on their own. Type 3, the symptoms develop after 18 months old, and these patients can walk but may experience progressive weakness over time. It's like a progressive disease. Type 4, or adult onset SMA, presents after 18 years old and has a much milder progression. So I think the older you get these diseases, it's a more mild form. The symptoms are progressive muscle weakness, especially in muscles closer to the center of your body, so your abdomen, your chest. Difficulty with motor skills like sitting, standing, and walking. Respiratory issues due to the weakness of the respiratory muscles. Scoliosis and joint contractures. Exhaustion. We use muscles to do every single thing we do all day long, and when they are weak, they need to exert more energy, which is exhausting on the body and the person. Diagnosis and treatment of SMA. Newborn screenings are now available in all 50 states. It is a heel stick test that looks for the SMN1 gene mutation, and if you have this mutation on the heel stick, they will do genetic testing to confirm the diagnosis. There's no cure currently, but there are treatments that can manage the symptoms and improve these people's quality of life. Gene therapy. Here we go. Zolgensma is a gene therapy that provides a copy of the SMN1 gene to improve motor neuron function. Spinraza is an injectable med.
Your face is
I
priceless.
should try to say these things. It's an injectable med that increases the production of the SMN protein, which slows the symptoms. There's supportive therapies like physical therapy, respiratory therapy, and nutritional management, which can help slow muscle atrophy and improve your muscle function. And early screening and diagnosis and treatment can turn SMA into a treatable condition and prevent rapid, irreversible loss of motor neurons. So they're just, all babies should be screened, especially if you're in this the Jewish population.
Yes, the genetic risk.
I mean, it's available for everybody.
Just stared at each other like, no fucking idea
What's
what
the
you're
word I'm
saying.
trying to say? But early screening and early treatment really makes this disease something you can live with. And that's that on SMA.
I'm telling you, if you're an Ashkenazi Jew, I think I would get genetic counseling before I ever had children, because these diseases are awful.
Yeah.
All right, so I'm moving on with another doozy, familial dysautonomia. It is another neurologic disorder that hits the Ashkenazi Jewish population hard. It is also passed from parent to child, and it is a mutation of the ELP1 gene. It is also known as Riley-Day syndrome. It hereditary sensory and autonomic this is another name for it. Hereditary sensory and autonomic neuropathy type 3, also known as HSAN3.
Oh boy.
I'm very proud of myself that I got that out.
Good job.
All right, I'm not going to lie. So symptoms begin in infancy. They have difficulty feeding, difficulty swallowing, inability to maintain body temperature. They have a lack of tears when crying. Oh. That's really kind of sad. I know people who have a lack of tears when crying. Poor growth, poor muscle tone. And as the child ages, they may breath hold for long periods of time. Oh. That's really comforting. This usually ends around 6, not because they die, just because they stop holding their breath. As the disease progresses, they have arrhythmias. I'm writing on this stupid pad and I hate it.
I don't write that on the backs.
I know, I'm going to have to stop. They have balance and gait problems, bedwetting, GERD, developmental delays with speech and walking, excessive saliva, so you're not crying, but you're drooling the shit out of yourself.
Yeah.
Eye issues, dry or crossed because of the lack of tears, so you're crossed for other reasons. Inability to feel pain and temperature changes, low vision or vision loss, lung infections, osteoporosis, loss, poor control in breathing, especially during sleep, seizures, vomiting, probably regulating their blood pressure. 40% of people with this will have periods of time when symptoms worsen. Like if you're in distress, anxiety, you're going to have worse symptoms. During these times, there may be a fever, sweating, or vomiting to go on with all the other shit you got to go on. Treatment. There isn't really any treatment treating symptoms. Okay. Antibiotics of chest or chest PT for lung infections, pacemakers, compression socks for the blood pressure, CPAP or BiPAP, eye drops for dry eyes, IV fluids after vomiting, meds for GERD, kidney disease, saliva production, seizures, and vomiting. You can do occupational therapy, tube feeds, and there is no cure. Some people can live into their 30s. Some can live into their 70s, but the symptoms are going to get worse over time. So it just makes it, it's just not a good quality of life with this.
Gosh.
So to help reduce complications, avoid hot or humid weather, limit stressful situations, refrain from long car rides. I don't know why you'd be on a long car ride with all this shit going on.
I know.
And try not to have a full bladder. And that is that disease, which is awful.
That is awful.
It is absolutely awful.
All right, well, I'm not doing one that's not much better. Gaucher disease, and I got this from Gaucher Disease News.
I didn't know they had a news.
I know. Gaucher disease is a genetic disorder caused by mutations in the GBA1 gene. This gene gives instructions for producing an enzyme called glucocerebrosidase.
Yeah.
Or GCase. We're going to call it GCase, which breaks down a fatty molecule called glycocerebroside. In someone with Gaucher disease, the reduced GCase causes these fatty molecules to build up to toxic levels in certain immune cells, which are called macrophages. These enlarged macrophages are called Gaucher cells, and they build up in
Hence the name Gaucher's disease.
Yeah. They build up in various areas like the liver, spleen, bone marrow, and brain and spinal cord. There are 3 types of Gaucher disease. Type 1 is the most common. It's 90% of all cases, and it mainly affects the spleen, liver, and bone marrow. It's called non-neuropathic Gaucher because it does not cause neurological problems. Type 1 symptoms can appear at any age. 2/3 develop symptoms in childhood, and half of those are diagnosed before 10. Generally, the early symptoms develop, the more severe the disease is. So the younger you are, the worse off the disease is going to be. Most common symptoms of type 1 include spleen and liver enlargement, low platelet counts, and anemia. 1/3 of the children have growth delays and delayed puberty, and the vast majority have evidence of bone problems on X-ray. However, bone pain, osteoporosis, and fractures are more common in adults. Gaucher type 1 the people with Gaucher type 1 have a life expectancy comparable to the general public. Gaucher type 2,
not so much.
No, is called acute neuronopathic Gaucher. It is marked by severe neurological symptoms shortly after birth, usually between the ages of 3 and 6 months. Early signs babies usually present with are rigidity in the neck and the trunk.
That's tough.
Yeah. Difficulty swallowing and abnormal eye movements. Some babies with type 2 will continue to reach milestones, but most will be developmentally impaired. As the disease progresses, most will develop an enlarged spleen and low platelet levels, and about 1/3 will experience treatment-resistant seizures as part of their type 2 symptoms. Because type 2 is so severe and progresses rapidly, most babies with type 2 die before the age of 2.
Oh.
There is a severe subtype of type 2 called perinatal lethal Gaucher.
I was going to say worse than what we've already just discussed.
It's literally called perinatal lethal.
Ugh.
Like
nothing should be called perinatal lethal.
No. This is the rarest form of Gaucher disease, and these babies are usually stillborn.
Oh.
Gaucher type 3 is called chronic neuronopathic Gaucher and is also marked by neurological symptoms, but is less severe and progresses more slowly than type 2. It commonly develops in children. Neurological symptoms occur by the age of 2 in half of the cases. Type 3 common symptoms are abnormal eye movements, seizures, cognitive problems, poor coordination, and all the type 1 symptoms. So the enlarged spleen, the enlarged liver, problems with the bone marrow. Life expectancy for people with type 3 is reduced when compared to the general public, but they can often live into their 30s or 40s. The symptoms. Because the spleen and liver enlarge, patients' abdomens swell and are very tender. And because the bone marrow is affected, blood cell levels are lowered, causing anemia, which then causes fatigue. And there's also low levels of platelets, which impair blood clotting, which causes easy bruising and hard to control bleeding. Bone problems like pain and fractures occur because of the reduced blood and oxygen supply to the bones.
Oh.
People with Gaucher are at an increased risk of developing Parkinson's disease. They are also at an increased risk of getting gallstones, diabetes, high cholesterol, myeloma.
As if they don't have enough problems. Let's give you all this shit to go
and
with
other
it.
blood cancers. Treatment for Gauchers is kind of all over the place, but there's 2 main treatment approaches, which are, one is enzyme replacement therapy, or ERT, and the other is substrate reduction therapy, or SRT, and they both work to reduce the toxic buildup of GB1 in the body. They're effective in managing many aspects of Gaucher, but work best in type 1 because neither of those treatments cross the blood-brain barrier. ERT provides a functional version of the GCase enzyme intravenously, where macrophages then pick it up and helps to break down the GB1. There are 3 approved in the U.S. There's Cerezyme, VPRIV, and Alesio. The SRT is an oral treatment that reduces the levels of GB1 inside the cells by blocking the activity of the glycosylceramide synthesis and preventing the production of the fatty molecules. So they help the fatty molecules not to build at all. SRT is only available for adults and is usually only used as an alternative to the ERT if its ERT is deemed unsuitable for that patient. There are 2 approved SRTs in the U.S., Serdelga and Zaveska. These names. Why can't we just name things easy? There are many emerging therapies for Gaucher disease, and they also help improve the outcomes for people with type 2 and type 3, which are very hard to treat. These include chaperone therapy. So apparently,
excuse me,
the GCase enzyme needs to be folded into the correct 3D structure to work to break down GB1. Like it has to be in this specific structure to fit in so it can stop the breakdown. So the chaperone therapy causes it to form that shape to work. It's
this
wild.
This is why I'm not a scientist, dude.
It's like how this thing has to be in this perfect 3D shape,
exactly.
but they do.
These people are highly intelligent.
Very. And so this chaperone therapy makes it go into that thing so it can help, so it can attach to what it needs to attach to and do what it needs to do. There's gene therapy, which delivers healthy copies of GBA1 to the patient's cells directly. They're also thinking that stem cell treatment can work, like a stem cell transplant, which involves collecting stem cells from a healthy donor and then transplanting them into a patient with Gaucher's disease, so it hopefully replaces all the dysfunctional stem cells. Generally, that's only considered for patients with severe disease that nothing's helping with. Gaucher type 1 treatment is going to be ERT and SRT. Gaucher type 2 is palliative care. There's no effective options for treatment. And Gaucher 3 is usually the ERT therapy for the non-neurological symptoms, and then they kind of just do off-label therapies to help with the neurologic symptoms. But they're doing a ton more research, and they're trying to come up with more treatment for this.
It's interesting that a lot of these diseases have to do with the fatty toxic buildup.
Yeah, it's weird. They're all
kind of related.
Yeah, but they're all different genes.
But it's very strange that they're not breaking these down.
Mm-hmm.
Well, we thought we would liven it up a little bit or lighten it up a little bit.
Because those were terribly depressing.
I'm not going to begin for 1 second to pretend I know one thing about Hanukkah or the Jewish religion enough to speak about it. I know what Hanukkah is, kind of. But we still want to celebrate our Jewish friends.
Yes.
Right? So the best
They're
thing,
often left out, and it's it's the same time as Christmas, so it's just everything's Christmas, right. And there's one little section at the store that's Hanukkah. It's awful.
And my daughter's got a couple of friends who are from mixed. They have Catholic or Christian families and Jewish families married, so they celebrate both, which I think is sweet. But for me, one of the best things of the Jewish religion is their food.
Yes.
The Jewish people cook some crazy ass food. I lived in Hawaii years and years and years ago, and the woman who kind of ran the house, she was 28. I was 22. She ran the house, and she was Jewish, and it might have been Yom. No, I don't know what it was because I was out there. No, it could have been Yom Kippur. And she made all these traditional Jewish foods. Man, a chef. She invited us in. I was like, yes, please, yes, please, yes, I'll have some. Yes, and yes, and yes. So watching The Marvelous Miss Maisel, she was always making her brisket. Remember? She was always bringing, she bribed people with her friggin' brisket. So that is a big Jewish holiday meal, and it's also good on Rosh Hashanah and Passover. It is prepared in a Dutch oven or a roasting pan, and you want to put a lot of seasoning on that little brisket. Mm-hmm. So that was a big traditional food. Latkes, which I also call just potato pancakes. But my potato pancakes are done a little different than the latkes. They shred them like hash browns and then fry them. My mother would take leftover mashed potatoes and fry them up, and I liked it like that with an egg on it. It made me very, very happy.
I love latkes.
I love potatoes.
I do.
Almost in any form you're going to give me. So kugel. I don't think I've ever had kugel. It's a traditional Jewish egg noodle casserole. Now you had me at egg noodles. Served as a side dish. It could be it can go sweet or savory. Swapping out sugar and cinnamon for vegetables and spices. It's a unique and tasty touch to your kugel with the following spices: dried fruits, nuts, and other ingredients. Now, I get locked in on food, and to me, egg noodles only go
savory.
Mm-hmm. So I bet
it's delicious.
I bet you it is, but I can't wrap my head around it because in my mind, it is just savory.
I can't pick when
Tuna
you said
the casserole.
Sweet
yes,
noodles. I was like, but
I imagine it would be fine.
I'm sure it's delicious.
But for me, I'm having a hard time.
If anybody wants to make some sweet kugel, and send it.
Oh, maybe not.
Just try it.
Okay. So I have a little. Let's see. I have a little thing here on Hanukkah. The holiday dishes are cooked in oil to commemorate the miracle of the single vial of oil lasting 8 days and 8 nights. About 1,000 years ago, in the warmer climates of the Mediterranean, Middle East, and North Africa, the Hanukkah specialty dish was cheese latkes.
Ooh, I bet that's delicious.
Which commemorated Judith's heroic efforts to save her people during the 2nd century. You would think I've been having a lot of Manischewitz here the way I'm talking, but I haven't. Okay. As the story told in the Apocrypha, they're probably cringing right now what everything I'm saying goes. The Syrian general Holofernes was sent to, he was sent somewhere by King Nebuchadnezzar, because I know that one, to annihilate the Jews. To make him thirsty, the beautiful Judith fed him salty cheese followed by wine. That would work for me. Yeah. The more he ate, the thirstier he became, and the more wine he drank. Mm-hmm. When he generally passed out, Judith beheaded him. Oh, smart woman. And his troops fled in fear. Thus did Asian Jews come to associate cheese pancakes with the Maccabean victory of their ancestors. Oh, that's cool. In Eastern Europe, where it was considerably colder, Jews did not have easy access to dairy products, so for Hanukkah celebration, remember when we were reading, we did Christmas traditions, and they didn't have things from milk. So I forgot what the food was that they stored. I can't remember, but it had to do with milk because you couldn't get milk in Europe. They turned their foods at hand. They raised geese with the Jewish occupation at the time, and in December, the fattened geese provided meat and fat for cooking. Potatoes, too, were readily available and cheap, which is how a crisp golden potato galette cooked in goose fat became a Hanukkah favorite. In Amsterdam, in the late 16th century, stewed vegetables became the Hanukkah dish of choice in commemoration of the Dutch military victory over the invading Spanish army. At dinner time on October 3rd, 1574, the Dutch launched a surprise attack on the Spanish military encampment in Leiden, forcing the Spaniards to flee and abandoning simmering pots of stewed vegetables with meat. Oh. Associating the siege of Leiden with the Hasmonean victory, Dutch Jews established the tradition of serving mashed stews of vegetables with kielbasa on Hanukkah. Yes, please. Yum. Okay, so other global Jewish food. I'm not even going to pronounce this, but it is Spanish Jews eat deep-fried eggplant rounds drizzled with honey. Oh. Skip the honey, I'll eat the eggplant.
No, but I don't even like honey, but that would be delicious on that.
When my mother was a kid, when we were kids, my mother would make eggplant parm. Not all the time, but when she did, she fries up the eggplant and she just puts it in egg and flour. And she'd have to buy 4 eggplants because we ate 2 of them just fried. She'd fry it and she'd be like, you guys, stop eating. I can't make one. I'm like, I probably should just make it like that. I love it. Buñuelos, again, this is awful. The light as air fried dough dessert is popular in Mexico, Cuba. You had me at fried dough. Cassola, baked ricotta cheesecake, originated in Italy. It's now frequently found in the form of cheese pancakes. Ooh. Fruturas del Malanga. Cuban taro fritters have a mild flavor and are perfect for Hanukkah. Gulam jamun, deep-fried milk balls are popular in India, typically soaked in rose-flavored syrup. I'll pass on that one.
No, that could be good.
Rose-flavored anything's not a big. I'm not a fan. Keftes de prasa, leek fritters. This sounds delicious. Are popular amongst Sephardic Jews, especially those in Turkey, Greece, and Romania. The alternative is kefta des espinaca, fried spinach patties. I'll take either one.
Oh, either one.
Kibbe. I'm some poor Jewish person out there is cringing at everything I say. The one Jewish person that listens to us. Those are in the Middle East. They are dishes made with bulgur grace, with bulgur wheat. Yeah. Grace the Hanukkah table. They're like meat pies, made with bulgur wheat. That'd be interesting. Kibbet yakin, Syrian pumpkin patties are traditionally made with bulgur. Malawak, Yemenite Jews top this flaky fried flatbread with eggs, zhug, which is a spicy herb sauce, and other toppings. I would eat that. Yeah. Samsa, sweet fried dumplings served with walnuts, are eaten in Bukhara or modern-day Uzbekistan. Svenj, deep-fried yeast donuts are popular in Morocco with or without the dusting of sugar. I'll take the dusting of sugar.
Yes, always.
Jalebi, crispy fritters, and squiggling patterns are most popular in India. They look like North American funnel cakes.
That's too much for me.
The circular fried dough pastry originated in Andalusia, which is where we were this summer, and is said to represent unity and eternity. tostones, which I read as testosterone. Twice fried smashed plantains are popular in Cuba and throughout Latin America, and they are perfect for Hanukkah.
That would be delicious. I love plantains.
Let's see, panella, fried chickpea fritters. I'm not a chickpea fan.
Oh, I like
love
chickpea.
hummus.
Yeah, but you don't like...
I do like the little dried ones that you eat, like potato chips.
No, I'm talking about the... What's it called? In the Greek rolls. The falafel.
I don't eat falafel.
Oh, I love falafel.
I haven't tried it. Fried chickpea fritters originate in Sicily and is sometimes eaten on sandwiches. Plantos fritos, fried sweet plantains, are popular for Hanukkah in Central America. And zalabia, Yemenite fried dough topped with powdered sugar or honey, is a popular dessert in Hanukkah. It's also very popular at Tops Hill Fair.
Yes, it is.
And any other white trash function we have. So that is some popular Hanukkah foods, which
They
love.
all sound
Hanukkah
delicious.
Foods. Happy Hanukkah to you all,
Happy
celebrating
Hanukkah.
your 8 nights. You're welcome to join us at Christmas too.
Yeah.
So be safe on your holidays, and we will see you in 2 weeks with our resolutions.
Oh, boy.
Wah, wah, wah. Bye.
Bye.
Like, subscribe, rate, and review the Scissors and Scrubs podcast on whatever podcast app you listen to us on. Follow us on Twitter, Facebook, and Instagram at Scissors and Scrubs. And email us any of your stories or thoughts to scissorsandscrubs@gmail.com.